Okay, I have a nurse here that I wanted to introduce because she's here with us at least once a week, Christy. Hello. And she takes great care of our patients, and I'm trying to put other people in these videos so that when you come here, you recognize them too, and it's not just me, the talking head. So,
even though she's the best one.
Christy. No, that's not, this is true. But I do talk a lot, so there you have it. Okay, so we have a patient that came a very long ways to be here and let Dr. Caridi operate on her nose today. And that is the blessing of YouTube, is that we can show you guys this whole experience, and then hopefully you feel more comfortable coming here, right? It feels like you've seen this all before, right? You've seen me before, you've seen him before, you've seen his work. It feels more comfortable, right? Okay, hopefully that's the goal, right? Education makes you feel like you have control over your situation, and that's what we are striving to do, is educate people. So you came a long way. I'm not gonna say where you came from, but you definitely had to fly here. Y'all didn't drive, did you?
No.
Okay. Okay, just want to make sure. And we're gonna operate on your nose. What do you want changed about your nose? Do you want to look in a mirror while you talk about this?
Yeah, it's so.
Here, I can hold it for you.
Me, like the main thing is like it's really long.
Mm-hmm.
It's really bulbous. It's really fat. Like when I do like kissy face, it's like
Yeah?
it like kind of goes down a little bit.
Okay, it dips down in the front, yes.
So it's just really big in general.
Uh-huh.
And then the hump.
Yes, the hump. Okay, so we do a lot of rhinoplasties, obviously, and so when we FaceTime, we can kind of tell you what your insecurities are, right? We've done a lot of this. We hear a lot of this. One thing that I want to point out that she said was how it dips down in the front. Some people call that a hook nose. That is a huge insecurity for people. When they smile, do you see it when you smile? Smile, let me see. See, it's not too bad. Yours isn't, it's not too bad. No, I don't even know if I want to call that a hook nose at all, really. But I get what you're saying, yeah. And so yes, she has a very high hump here. She has a very feminine face overall, but the nose is just almost too big for her face. I can say that, right? It's just too big for your face. Does it run in your family at all? Nobody else? Nobody else? Yeah, her sister's here, right, sister? And she did not want to be on this video, but they don't have the same nose. So I'm very excited to make this nose more feminine and delicate to fit her face. But Dr. Caridi is always talking about how there's limitations, of course, but the goal is to make it look as natural as possible and make it look like it belongs to you, right? That it's not changed in any way. It was almost like you're born with it. So that's what we're going to achieve today, what Dr. Caridi can do for you today. And then she's gonna go home. When are you going home?
Today. Or no, tomorrow.
Tomorrow, and then she's gonna fly back for her follow-up appointment. So if you are out of town, that is an option. We do work with you on that. That follow-up appointment will be the only one she comes back for. That's when we'll remove the splint. We'll talk to her about taping her nose. She might have to do that. We'll see. Dr. Caridi decides that. And then from there, we'll follow up with you via FaceTime, photos, email, all the good stuff. But we do try and make it easy. If you are wanting to come here from out of town, we can accommodate that. And then what else? Is there anything you're nervous about or anything you've been thinking about, questions you have?
No. I'm really excited. He's a professional and he's been doing this for many years.
Mm-hmm. It's true.
I'm in good hands.
You are in good hands, yeah. So we'll bring Dr. C in, let him meet you in person for the first time, because we've only talked to her through FaceTime. And then, yeah, we'll go from there. And you've been wanting to do this for many years, right?
Yes, a lot. Like my entire life. It's just everything's been like lining up.
Yeah.
It's the time now.
To get you to this point. I believe in that. That's cool. Okay, so we will show you surgery as well as we'll get some follow-up photos. Hopefully you're going to give me follow-up photos, aren't you?
Yes.
Okay. Some people come here and then they never give me follow-up photos. It's heartbreaking. I need to see the progress. So, all right, we'll bring him right in. Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please Go do that now. When you do that, it helps us grow our community. It helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
So you talked and everything, right?
I think I did.
She did a little bit. She was a little nervous, as they say. Nervous. Okay, so we're going to reiterate the stuff that I was excited about doing her because she has a perfect nose to make better. She's got beautiful facial features, gorgeous skin, unbelievable lips. So when I look past the nose in terms of all the things that are going on, and I see her nose, and I just picture her nose as just being, it's just too big. And it's too long, and it's got too much mass in this area here. So a lot of the gain will be picked up on the side view here where she's got a better profile. I'm going to shorten her nose, which is going to kind of not pig it out, just shorten it, which just is too long. The septum's too big. She's got a little bit of a plunging tip, and it's like a seesaw effect. With the high point here and the low point is over here and the low point is here, it's sort of like a seesaw. So when you smile, give me a smile, it tends to pull the tip down in this area. And I know other people talk about a little muscle in there, but you really don't have to deal with that muscle as much as you think. It's one of these things that everyone gets on the internet and reads about, but I've never had to really treat it. It's not necessary. Once you rebalance and sort of reconfigure the nose, it's just in a better circumstance entirely. She's got good size ala here, but we're not going to really do much for that because there's not much I can really do. It's just uniqueness of her anatomy, and sometimes we manipulate the ala, but not in her particular case. So it's really reducing the bulk of her nose, shortening the nose, getting a better tip, and just working in a finer nose, and we're going to show you how we do that. Up to get in there and fix her nose, which I think is going to be a classic nose, more or less. It's got all the features that are pretty typical. And I think any one of you all that follow me, you know that my mantra is keep it real, keep it normal, keep it safe, keep it reliable, keep it consistent. Noses are complicated. They're not for the faint of heart. So you got to have a lot of experience with them. It takes quite some time. And you have to really put your trust into people to do your nose. So do your homework very carefully and make sure that your expectations are really in line with what can be achieved. I make happy people, which is a good thing. That's why I like doing a lot of noses, because patients are pretty happy. Not everybody, as usual. There's always those 1%ers of the grades of the stars. It's like you had someone have 105 stars, but there's always a few 1 stars. But you know, for most cases, these are pretty straightforward, reliable, and they make people happy. And so they're fun procedures to do for me. So I appreciate the privilege. And I know sometimes you like the details, so we're going to give you the details too. So my new videographer for the day will do his best in sort of capturing the essence of the changes that we're going to make today to give her a rebalanced nose, smaller, more petite, more feminine, something that fits her face better and makes her happy.
Yeah.
So one thing I noticed on her case already is she's got very small lower lateral cartilages. So these cartilages here are really small, and they're oriented, we call it oriented cephalically, which means they go back this way, whereas a more optimal rotation would be this way. But so that's something I got to take into consideration. But she's got pretty much nada here for her cartilages, which kind of makes sense because look how small her tip is. It's already pretty small. And then you can see how bulky this is. So you can imagine reducing a lot of this bulk here is going to make a nice difference to the overall result. All right, let's do some tunneling here. So in her case, I know I want to shorten her nose a little bit, so I'm going to make a hemi-transfixion here and expose the cartilage of this caudal septum here. You can see that here. Can you see this?
Let me clean it too.
You know. This is
There it is, right there.
her septal cartilage. This is the cartilage that divides the nose in half, two halves here. So we're going to expose that just because I know I'm going to shorten it up anyway, so I might as well use this as my entryway. All right, give me the free her, but not the free her the elevator coddle. Oh, good for you.
Hey, hey.
Look at you. So I already know that she's a really weak tip, so that's just a big clue as to how I'm going to sort of approach this case in general.
The cartilages are weak.
Yep. Yeah, they're small. I mean, when you think about it, the rest of her nose is so big and overgrown, and then you come to the tip, and then all of a sudden it's these little itty bitty. Look at these. These are tiny. Case I did yesterday, they were massive cartilage for a much smaller nose. So you know, you just don't know. All right, knife. Really good view of the septum here. All right.
Good.
All right, you're going to hold the tip, and now we're going to take this. We're going to start to take the dorsum down. Dorsum being the top part of the nose. That's kind of big in her case. So we're going to get past these puny little tip cartilages here, which we talked about. And knife.
Come on.
There you go. So we're going to separate the components. Oh yeah, I'm looking at a nice picture of her big nose there. Big ala too. Look at the size of her ala. So the ala make up a big portion of her nasal tip. All right.
You're done. Oh, no, you're right behind it.
Okay, thanks for telling me.
Right over your shoulder.
Okay.
All right. Out there.
To see the piece that he took out of there.
You then
Coming down.
guys, that's it.
So we took a little piece of cartilage out of here, and she's got this big old bone here we're gonna have to go after. So let's go get that now. So give me a rasp. This is all bone here. Actually, you know what? I think we may need a chisel.
Okay.
Maybe easier because this is a chunk here.
Exactly.
So instead of using a rasp or a file, we're going to use a chisel, which will get down a big chunk of this all at once. It'll just make it a little easier.
Do you like that one?
Yeah, that's a good one.
Okay.
Okay, easy.
Easy.
Good. Go. Go. Good. Go. Nice. Go. Okay, go. 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 Excellent. Okay, so we just got a piece of that.
I think I can get it out.
Sure.
All right. And coming down.
Yeah, you pull out, let me cut around it.
Okay.
Hold this. Scissor. I mean, or a knife.
The knife.
Okay. So you can put that on the outside of the nose there. So that was from here, right? Up right here. Yeah, so this was... It was right there. And we start to get that off, and then we're going to shave this more. So you can see the hump is already disappearing. But let's get the medium side rasp. And we're going to start to rasp and reduce and really work to get this down. This part's like woodworking.
I like this part too because you can see it automatically, you know? It makes a big improvement quickly.
So as a general rule, what I'm doing is working to balance the nose, and I usually start with the dorsum to lower that to where I want it, and then work in a nice tip depending on the dorsum. So it's like you have to go to first base before you get to second base, that kind of thing.
Start from the top and work your way down.
Yeah, so...
I feel like when you do this, you can also tell how wide the nose really is too.
Yeah.
When the top comes down, you can see the width of it a lot.
Yeah. It's a triangle, so when you take the top of the triangle off, it gets wider as you go lower. So you can see how it's already gotten wider. So that procedure removes the bone, but you got to use the knife to get the cartilage. So we'll just go back and forth until we get it the way we want it. All right. Hold that tip away.
Okay.
Knife.
It was not still good. Are you ready to switch it?
It's still good, but
All right.
you got to switch it as some junk.
Can you grab me that stool?
Yeah.
Okay, scissor now.
In what?
Second. Oh, sorry.
You thought it was on the other
I
side?
didn't hear it come over.
She's a ninja as.
She's ninja.
Sorry, these are sound blocking earphones, so all I hear is your voice.
Be careful, he'll buy this for the whole office.
The right thing.
Mice, just be careful when you're second back.
Okay, thanks. I'm just gonna stay where I am for a while.
All right, rasp. So in my mind, I'm trying to work to make this smaller because this I already know is small and undeveloped. So I have to sort of shift the balance to here and reduce it here.
Get that artwork out, actually.
Oh, yeah. There's a part where it just goes down.
Yeah.
There.
You're just hoping that you can still hold on to it.
Last time
Don't come over the bed.
when I drove home, I could barely keep it.
Oh, yeah.
Oh my god.
Eh,
They're like the shoulders as well, but
yeah. You gotta have good posture.
The front tips of your shoulders just lock up and die. I forget if I asked you this last time, but can you make your nostrils bigger? There's a procedure to make your nostrils bigger.
Yeah, plastic surgery can pretty much do everything, but the question then becomes, would you? And the answer is, that'd be more of a reconstructive procedure. More reconstruction than cosmetic. So again, I'm just trying to play with the balance of the nose here. When I shorten it and set it back a little bit, that's going to give you a little bit more height on the tip too. And you can see there's a set off now between the height here and the height here. So we're in a better proportion already, but I still want to do more, because whatever I create here, she's going to lose a little bit during the healing process. So I want the differential from here to here to be a little bit more exaggerated than it is now. And that's the nuances of the nose, and that's why you got to do sort of a lot of them to know what to expect. All right, show me that tip.
Safe.
All right. You gave me a fresh blade? No? Yes?
I can.
Yeah.
Will you hold that for me?
Uh-huh.
Telling you not.
And you could hold inward first thing.
Okay. This scissor now. I'm just trying to get this smooth and even. Okay. I don't. Very big, wide bones here. Getting closer, but still want to do a little bit more.
But there was time I think you might she got a bunch off already.
Okay, rasp.
Okay, let me count these. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rest.
Her nasal bones are all flared out to here, and the open, we call it an open roof, is this area where I've just taken, it's almost like I've taken the roof off the house from a storm or something, and you're just looking at some of the living rooms. That's what's going on here. And then I'm going to close the roof when we fracture the nasal bones. So you get the idea there, right? You can see the step off, right?
Good.
So, and then the shortening of the nose is going to be the manipulation of the cartilage that I'm going to do on the tip a little bit, not that much. And then shortening the septum here, but getting close. Pretty close to where I want to be. Rasp. I don't want to reduce it too much because then you weaken the nose. I had a case I did yesterday, and it was a secondary case, meaning that it had already been done.
By someone else.
Yes, somebody else. And they took too much dorsum, this whole, and there was nothing to work with. And so I had to really work hard to balance the nose by working on the tip, and then it was just tons of scar tissue. Secondary noses are more complicated. A lot of people send me, fix my nose, and I'm okay with fixing some noses, but not all of them. So sometimes I'll be like, nah, that one, not so much, because I know what it entails, and it's a lot. And
So there's noses you won't fix.
yeah. Well, in a ideal world, if I was in some third world country, I'd work on every nose, obviously, because I can. But in today's advanced American society, everybody has expectations and stuff, and it's just harder to meet expectations when things get complicated, really complicated. It's just not as predictable and reliable. And remember, I always tell people that, I want to pick a procedure that kind of makes people happy and is straightforward. Well, straightforward as straightforward can be, I guess. Okay, so you kind of get the idea. You got mass here, a lot of mass here, not as much mass here, and then a little bit of mass here. But so it's a little bit of a wah, like out, in, out. This fracture alone will help that a lot. Make this smoother. That's what I call smoother. And the tip, yeah, I don't have much work to work with on the tip. So I want to get this dorsum right before I start working on the tip, because the dorsum is kind of rough and the rest is more delicate. So suction. Let's irrigate a little bit in there.
Okay. I'm going to be backing up. Large?
A little bit, yeah. Huge nasal bones, yeah. Okay, that's good. Good.
Local. Oh, I see it.
All right, knife.
Stop. Bring it down.
Like that.
You're okay. There. All right, rasp. Here.
He turned up the over test.
Turn it up.
Yeah.
How that's looking.
Okay, that's good. All right, table up a bit there, sir.
Right.
All right, now I'm going to trim the caudal septum. You can come over here, you get a better view, Walter. Okay, double hook, the big one here.
See?
This will be a quick procedure. Holding this over, you get the cartilage right there, you see it? You want to hold these? Yep. And this is what's, yeah, this is a good view. This is what's contributing to the length of her nose to some degree. I'm not going crazy here, but I'll take 2 millimeters, 2.5 millimeters. This will affect the slight rotation of the tip.
Down, what she complains about.
Yeah, it'll affect the balance of the tip and rotation and the length of her nose. So I'm getting a lot of action out of this little piece. It's hard to believe that this little piece alone makes such a difference. Okay. Oh. Boom.
So you can you turn that back down?
Yeah.
You want it downward and out?
Yeah, I can count. And yeah,
Big ALA here. I may come back as a secondary procedure, depending on how I like it and how she likes it, and just reduce a little bit of the ALA here. But I'm hesitant to do that today because you just don't know. You could tell she's weak right in here as well because these cartilages of the tip are so weak. Anyway, I'm going to take a look at the cartilage now. Putting sutures in the cartilage of the tip actually helps to strengthen a little bit. Okay, give the C-shaped retractor and you'll show me the tip gently. There you go. Okay. These cartilages are going this way. In other words, it's going this way when ideally it would be better like that. So they're just cephalically oriented, cephalic towards the head. So, and I don't have a lot of room to work with, and I don't want to overly weaken them either by suction, by freeing them up. So when I yap like I am, I'm just trying to pretend you're the surgeon and this is what you're confronted with and decision-making process.
You want the cottonoids back?
And that's pretty good.
Yes.
Not bleeding. She's not bleeding. All right. All right, let me give it a stitch. So I'm going to start off by putting a dome stitch here just to sort of get a little oriented here. See if I can create strength where strength doesn't exist. And another thing I can do also is put cartilage in here, which I still may, but we'll see. So let me tighten that up, and you get to see how that gives me more of a defined knuckle, if you will, on this side. And it did turn it slightly in a more favorable direction, but only limited. So, see, well, you can see the difference. So, you can see the shape difference, and you'll see how it changes when I tighten this up. Boom. So that's better. But now I have more flaring here, and I'll show you how I'm going to address that. So flaring is this split here on the tip, and I want to pull these together a little closer. So I'm going to take a bite there. Take a bite there. And tie it up and take a look. And if I don't like it, I can always change it. See, you saw how that came together. Okay. All right, take that out. So now what I'll typically do is just take a look and see what it did. She's getting swollen, so I got to squeeze a little bit of that swelling out of there. But I mean, it's not an overall huge difference, but it actually is. It's a little bit more well localized here, and I got a little projection, definitely. And it's definitely stronger. When I push down here, it's definitely stronger. And I have a nice set off here between the height of this, the tip complex, and the dorsum here, which I lowered. And I've yet to narrow that. I'm still frustrated by the size of these lobules, but I may come back and sort of, like I said, secondarily reduce them if we're lucky. And she's got pretty wide foot plates here too, which are the spread right in here. But if I narrow this too much, then her nostrils become too big. See, there's always a lot of stuff going on, and it's a lot of sort of artistic interpretations of things. I think that looks pretty darn good. If you notice, I haven't entertained doing any shaving of the cartilage up over here as I usually do on the tip, because they're weak and it's really not creating too much fullness here. Remember, this was a lot smaller than the rest of the nose, so if I make this too small, I weaken everything, and then I don't have that balance. So what I'm going to do now actually is just go right to this, right to the meat, and let's fracture these bones, and let's see. Hopefully, Volta can show you what that does to the whole proportion of the nose. Walter, a good shot would be coming right from the top to see the width if you can. So straight down the pike if you can, Walter. See how wide that is? You getting that picture, Walter? Yeah. That'll come in handy in terms of
How this goes.
how this goes.
All right, got it.
Good, all right.
Or is it German?
Yeah, German. Go. Russian, yeah. Walter. Go. Go. Oh boy.
Like trans.
Go. 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 Nice. Go. 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 Big bones. Go. 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 Woo. Oh, good. Go. Go. Good. All right, I think we got one down here. Go. 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 Oh, nice. Finally, go. Oh, go. 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 Woo. Go. Go. Oh, baby. Look at that, baby. You had to work on that one. Tap, tap. Go.
Golly. Okay, give me a chance here.
Yeah, no shit. Go. 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 Oh boy. Finally.
That was probably harder than I've had to do it before. Don't put that in. Hey, put that down.
Go. Go. Oh, nice.
Come.
Okay.
Felt it.
Okay. Okay. Go back down here. I'm sure we're missing something. Go.
Felt it.
Go. Okay, good. Yeah, it's good. Go. Oh, nice. Go. Oh,
I
okay,
feel
good.
it. I just
She
leave.
feels it. She feels it. All right, so we definitely
Okay, here we go.
broke those bones. So now we're gonna.
Want another shot from the heavens?
Well, it already narrowed a little bit, and he already has that shot. All right, so let me hold that for a while.
That's a good one.
Did you hear it?
Yeah.
Are you
Okay.
gonna pass out on it?
Maybe.
Just
Not really.
All right, I'm gonna hold this for a few minutes so you don't have to
break. Put your
take a break. Yeah.
So this is the result of breaking the nose and narrowing the bones.
Oh,
This is
look at
the
that.
most exciting part of the rhinoplasty wing.
And I think the important part here is to see how the proportions of the nose change with
And he's
this.
squeezing out the swelling here, so kapow, look at that. That is amazing.
So it's a huge change in her nose already.
Christy, come from our position.
And so what's interesting now is look how the proportion of the tip now looks bigger than the rest of the nose. Isn't that really fascinating? And the lobules looks kind of big and the tip actually looks a little bit big. So now I may go back actually and just trim a little bit of the cartilage in this region here just to refine that tip ever so slightly. But you can see how the whole balance of the nose has changed. It's shifted. This used to be the bulk. Now it's all here where I told you it was weak as all get up. And look how it's shifted. It's really fascinating, if you ask me. And now these are bothering me, but I don't have consent to do that. But I can come back and do that. That's not a problem.
Tell him what you're saying here.
Oh, the alar, just the bulk of the alar is a little bit big.
So you would make an incision right here?
Yeah, a little wedge resection and just reduce, and that'll reduce the bulk of this relative to these three, because now these look super bulky. But that's easy peasy, so I'm not worried about that. But that's nice. So let me look at the tip again.
Okay. You want the smaller?
Yeah. So the cartilage I'm talking about on the tip is just this area right back over here where it, let me show it to you. This region right here, you see this? I'm just going to trim that a little bit. Not much because I don't have a lot to work with. I also think her skin is a little thick in this region here on her tip.
Can you point to it again?
Yeah, so this area right here and so this is the lateral crura right here, but right in here I'm going to reduce that a little bit. But I'm going to sense out how big it is. Hold this.
Okay.
Because it really is kind of weak, and I think a lot of the fullness that I'm saying is related to the thickness of her skin, which I really can't do much about. So sometimes I have to just accept
The limitation?
the limitations that are. Yeah, just a wee bit. I'm going to just trim that ever so slightly. Okay, scissor, they're angled.
Walter, the video that you did for us last time, is it already out?
No. I think he's still waiting on y'all to do a follow-up.
Oh, okay. I was trying to remember who it was.
It's a white lady, big nose.
Okay, ease up on it. Good.
Great description.
Okay, out.
Do you cast them? What do you?
Yeah, that made a nice little difference in terms of removing some of the bulk here to a nice narrow dorsum. A little bit of super tip break right there. It's balanced. I think a lot of the problem I have now here is just the thick skin. Look how thick it is here. See, it's very thin. Right here, it's very thin. Thick all through here. Sometimes I could...
off the underside?
Sometimes I reduce the underside a wee bit, but
Like,
this has dubious. Grab that.
okay.
It's almost like there's a thick pad here. And this maneuver also will facilitate scar tissue, which not necessarily what we're looking for. Okay, so a little thinning, but not much. Yeah, loosened it up a little bit, but thick pad in that area. And so what I'm going to do now is, once you get that top photo, so pull that over and I'll squeeze the juice out of this. Give me a moist, so you can come from above and have that to compare. So straight up. Here, let me squeeze it, and then you can try to get that same.
Okay. I'm set.
Okay. You good?
Got it.
Good. Okay. All right, let me put a stitch to secure the septum to the
Okay.
PDS.
By highlighting it.
It's reverse. Do you want it normal?
Normal.
Yeah.
Stitch. Why do you have it reversed?
I was asking if you wanted it.
And you said reverse or normal, and I said normal.
Oh,
You
I
handed it to
didn't
me?
hear that.
Oh, okay. I like when people don't hear
You
me.
know, I'm gonna be 40 soon.
Oh boy.
Maybe we should do 3 for 3.
3 first.
3 for 1.
3 for.
We're real close to your back.
Okay.
Yeah, you're on the wrong side there, buddy, for this stitch.
I can see that.
Yep. Okay. Get out of there. No, I need you to just kind of hold that right there.
Okay, gotcha.
Good, that's nice. So this stitch actually does 2 things. It helps secure the shortening of the nose. It helps to place the columelus, this thing here in the middle. And I can actually elevate the tip as well by suturing the whole complex to a higher position on the septum. So whether it stays is another story as usual, but that's what we think. All right, so that's pretty nice.
Yes.
Oh, good. So did we have a consenter for ALA reduction, or is that was part of, no? Yeah, I don't want to do it
Yeah.
if we haven't talked about it, but that's something I can do in the local. Because it would be a cool addition, boy, that would be.
Yeah, really
So
bring that in.
basically, hopefully, if I just remove this wedge in here, if you could see it from the bottom, it would just make her nose look less bulky. Just even more refinement. Okay, good. I'm good. Let's get out of Dodge.
Okay.
Oh, I want to put one stitch here to close the roof. So
Okay.
Here we go. This one too big?
yeah. To say that I can't see anything would be a gross
Can I have some suction?
understatement.
No. Okay, thank you. When do you get your earplugs?
Earplugs. I love it. Well, I don't know. I think Monday I have to.
Suction. We're done. That's the only one. All right. Thank you.
Yeah. Okay, let's close this up. All right, so we are done with that nose, and I feel really, really excited about her. And I think it was a great nose for you to learn a lot of sort of issues, or sort of the descriptors that I use: proportions, balance, strength, relationships. That was all in this case. So her tip was kind of small, and her ala, the nostrils here, were kind of big, okay? So the tip was small because her cartilages were quite small, and they were oriented in a cephalic direction, meaning they were going this way, as opposed to, let's say, that way, right? And so the relationship was she had a large ala, she had a small tip, and she had a huge bony vault. So what we did is we reduced her bony vault, took her dorsum down, and then I narrowed it by that infracture, and then suddenly, out of nowhere, major relationships changed. The mass of her nose was a lot less. The dorsum was lower than her tip. So her tip now was above the height of her dorsum. So those were two major goals, okay? The width of the nose you see on frontal view. On profile view, you get to really appreciate the humps, okay? And then that left me now with the tip and the ala. Now, the ala we talked about, I feel like I need to go back and just make them less bulky. Again, proportion, balance, femininity even. So femininity has a lot of those features involved. Smaller nose that's smoother, more proportional, and more balanced. I put some sutures in her nose to strengthen the tip so that it holds up and resists the temptation to want to go down during the healing process. And I definitely shaped it up a little better. Did a little bit of thinning of the subcutaneous tissue of the tip here. She has a fat pad on her nose, and that's definitely going to preclude this finer result that someone else would get if they had thinner dermis. But she doesn't. It's not uncommon. So that's just something we got to deal with. It's sort of just like the ala. I mean, you know, they are what they are, and everybody's different. And this also gets to the point of me telling you that I can only do what I can do based on your anatomy. If your anatomy lends itself to changes that I can make that are a positive and move in the direction that we want to go in, well, then that's a good thing. If you have thick tissues and your anatomy is not really cooperating, well, we can still make a huge difference, don't get me wrong, but we may not really get to that point of nirvana, okay? So that gets into expectations. Your expectations need to be realistic, because if they're not, then you're always wishing that you wishy. Stop being so wishy-washy. Accept these huge differences that we can make. You get a normal nose, no one will even notice it, but the difference, the delta, the change from side to side is absolutely ginormous. So anyway, super happy for her in a big way, and I think that this is going to be a nice video. It's a good, instructive video, and I think the only addition will be reducing some of the fullness of the ala, some of the bulk of that ala, so we get it more balanced and refined.
You ready?
Ready.
Okay.
Let's see this.
I think we're 7 days post-op. Gonna take off the splint, see the big reveal. Hi. I'm bringing Micah. Okay.
Hello.
All right. Let's get you moved up. Here, can I take your bag here? Okay. And Micah, I'm gonna stick it over here. So is it 7 days today? Is that right?
6.
Okay. You didn't bruise bad.
No, it was a good recovery.
Yeah, it wasn't too bad. Well, that's good. What was the worst part?
I'm still having trouble breathing a little bit.
Yeah. Feel congested in there?
Yeah, one of the nostrils was kind of like closed. That's why I was going to ask the doctor.
Yeah. So a lot of times you'll get that kind of, you're just inflamed in there. It's traumatized. This will all make it feel better, but you'll probably still have some of that inflammation. Does it feel dry in your nose? Okay, good. Good. All right. So, here we are. This was a week ago. And I think I said in the previous part of this video, but she flew here for this surgery, so we're really appreciative. And so that is an option for anybody looking from out of town if you're wanting to come do this here. So obviously she had a complaint about the hump, right?
Yes.
The hump and the width of the nose. And Dr. Caridi worked meticulously because I was in there with him. And he worked really hard to get that just right for you. So I'm really excited. So as I tell everybody, when it comes to splint removal day, it's going to be swollen, especially on the tip, okay? Because the splint covers everything but there. So all that swelling is being forced to this one spot right here. So you could probably speed up through this, Micah, but I'll show you what we do. Are you nervous?
No.
Okay, good. I just wanna
You're a
make sure.
pro.
I'm a pro. I've done this before and on camera, I think.
Questionable.
It's questionable. Questionable. Good. I'm really pleased with the bruising. She really didn't bruise that much. Did you ice it a lot?
Yes.
Okay. We tell people ice it a lot, but I don't know if everybody does that. All right. So I see the tape must have come off and then you had to put it back on somehow. You did a good job.
Okay.
You were creative with that. All right, so free that up. Okay, you see we've got some sutures right here that we'll remove. I can tell she's swollen in there. And then I'll just get you started here. Does that feel okay? Mm-hmm. So we put mastisol underneath this. And so it can be pretty stuck down, but hers looks like it's moving a bit. We'll just take our time getting it off. I always try and get in on the 7-day post-op rhinoplasties because I really like to do this and see what the result looks like. Even though, like I said, it's not the final result, but you always can see a huge difference right away. Some people swell more than others, and that's pretty standard. You okay?
Hmm?
But I'm hopeful. Because of the bruising. Wow.
Dark.
Look at that. So you can already see the difference, right? If you're looking here, that is just a huge difference. I promise I'll let you see.
That's it.
I know. But that's a huge difference, and I can still see the swelling right in through there. But wow, it's already dramatically better. Dramatically. Look over at me. Oh my gosh. Yeah, swelling all through here, which a lot of work was done. And so this will just get better and better with time. Okay, it's your turn. Let me grab the mirror. Take a look. Again, not the final result, but it's pretty sweet. All right, hold that.
Oh my gosh. That is not me. That's crazy.
Isn't that cool?
It looks amazing. Oh my.
It really does.
Oh my goodness.
It's beautiful.
Oh my gosh. Thank you so much.
Thank him when he comes in. He does a really beautiful job. I love to see these rhinoplasties because it's just.
That's. I'm in disbelief right now because I've touched it. I've looked at it like a bunch of times.
Yeah.
And wow. That's. Oh my gosh. I can't believe it. The bump is gone. Like this was huge and this was drooping.
Yes.
Oh my gosh. My mom's
Smile.
gonna freak out.
Look at it when you smile.
Much
Oh
better.
wow. It's so
It's
nice.
straight and it's
Yeah.
like narrow.
Yeah.
I'm gonna look at this all year.
You should. I mean,
Wow.
here,
The
let's.
rest of your life.
Yeah. Okay. So, Micah, can you see? Is that a good angle for this to appreciate this side?
Wow.
Yeah, that's really cool.
Huge difference.
Yeah, we'll have to look at all of it. But yeah, just the overall width of her nose. I like the closer ones. Let's go back. Yeah, that is no longer there. Wow. Pretty cool. Here, Micah, look from here. That's awesome. Really cool. Okay. I'm going to put a little bit of numbing on the suture line. Makes it more comfortable for you when we take out those stitches. But after that, you can just kind of take a look at it. Keep looking at it. You got some scabs up in there, but for the most part, it looks fantastic. Okay,
Where'd you fly in from?
It's up to you.
I could cut it out too.
California.
Yeah.
Yeah, it's really cool. What are you looking at?
I was looking at it before. It was really bad. Oh my god.
You feel like you have pictures that is worse?
Yeah. Like look.
Oh, that's a good one. Show Micah. Can you show Micah? Yeah.
It was worse than
The photos?
the, The photos look kind of good there.
Yeah.
But like this one, you can see it's
It's just
huge.
big. It's just big. It just doesn't fit you, you know?
Mm-hmm.
You are not
That
big
is
in any way, so that does not make sense, right?
Gosh.
That is so cool. Okay. I know you got to get going, so I'm going to get Dr. C in.
Dorsal. Whoa. Oh, look at you, my
She just
God.
keeps staring at it, which is fun.
She's a starer. Look at you. You starer. Oh my God. How weird is it?
Super weird.
Yeah. Super wide nose, and now it's not so wide. Nice tip here.
I'm kind of struggling with one of the nostrils, but
Get clogged. We gotta get you. We gotta do some rotor-rooter in there. But that's pretty cool. What's your reaction? What do you think?
I can't. It's not me. It's crazy. It is, but it's not. It's.
Big reduction in your
You
nose.
did a whole
Look at that.
360.
Boom.
Like you knew it was gonna be different, but you can't prepare for it.
I don't know how he did it. Like I kind of expected like just the hump, but he
Wasn't
like
easy.
I don't know like
Wasn't easy, but it was a fun time. I'll tell you, it was
Very
an interesting nose. Well, I think I talked about it during the video, right? Didn't we? We videoed.
Walter
right?
was there.
Yeah. Oh, that's right. Walter was there. So, the interesting thing, you have a big ala here and a small tip, and then all this mass here, and so proportional means this is off. Got you a better tip that's bigger now than your ala. Got all this mass down big time so that it's much more normal, and most importantly, it's the width. You can't appreciate the width of her nose here, but I mean, very wide. So when we fractured her on the table, I mean, it was shocking when we took the Raytech off and we saw the nose for the first time after I broke it, and brought it in. I mean, she was like, whoa. And you can see how much narrower and how straight it is and how that actually defines her face totally different,
And that'll even continue to.
Oh yeah, and she's early, obviously, so it's going to continue to shrink, which is really kind of a cool thing. But you could appreciate the width of her nose that she doesn't have now, which is really kind of cool. And when she smiled, the tip came back, went down a little, but that's not going to happen. Put your head back a little bit, and you can see there's a better proportion in the triangulation of her nose here. We're going to clean her up a bench, but like I said, she's pretty darn swollen in here. But that gets better with time. Nice. Very swollen, in fact. So this is a great start. And the only thing that I was trying to tell, well, we didn't tell you, but telling myself, I don't know, she looks good. The proportions are really good over here. Just very swollen. So she's only, a week?
Yep.
And so a complete nose takes about 2 years for it to get, really where it needs to be in a lot of cases. So it's like the gift that keeps giving. It's just going to get smaller and cooler and cuter with time. And all she has to do is just tape her nose and just really do nothing, enjoy it, and let it shrink down. You look different. Your face looks different.
I know.
Your proportion. And so the hard part for her now, it's actually, I don't know if it's a hard part. You're seeing yourself for the first time in a way you've never seen yourself. That's weird, right?
Yeah.
And you're in the middle of it right now because you're like, she's looking at me. You could imagine it's like you're looking and you're like going, oh my God, and then you look forward and you look around and you're doing all this here. This is yours. It's hers to relish.
Change. Oh,
it's weird.
It's a huge change. Thank you so much.
Oh, no.
It was like a big issue for me.
I know.
I was just like,
I know. And you're not done. You got a ways to go. So it's just it's the gift that keeps giving, like I said. So you're going to become more in love with yourself as time goes on, which is, it's not to mean everyone has to have their nose done and have to be perfect, but it blocked you. It slowed you down. Mm-hmm. It was something that anybody would have some problem with, right? And now we're past that, so it's exciting, and I'm happy for you. Don't make me cry. It's just exciting.
It's a big difference.
Yeah. Well, we'll get you cleaned up for sure.
Gosh.
Did you send pictures to your family already?
Yeah, they're like, the hump is gone. Oh, I can't.
Is it a family trait?
No,
would you say?
it's just me. Like, they all have nice noses, and I was like the one with the bump. And,
Wow.
But I waited.
No accident or
No.
just wow.
Just bump.
Yeah.
I waited and waited, but this is.
They're super happy for you.
It's
Yeah.
amazing. I don't know how he did it, but
Well, you'll be able to see. I don't know if you'll want to see, but
I want to see.
there will be a video.
And he probably did like a lot of like intricate things and like inside.
It's a lot. Have you watched any of these videos?
No, not because it's kind of
They're intense.
Mine is deviated, and then there was so much wrong with my nose. I'm kind of curious what he did. Oh my gosh.
It's my favorite one to record just because it's such a dramatic shift and it's so small changes but big impact.
You don't get grossed out?
No.
So you have a passion for her
I
surgery?
growing up, I used to love watching Discovery Health Channel. So it was like now I'm like doing Discovery Health Channel. Yeah.
Oh, that's good. Do you actually make the videos or?
Yeah, so I record them and then I edit them and then post them on
That's a good
YouTube.
job.
Yeah.
Yeah.
The videos. She hasn't seen any of them.
I've seen some, but I haven't seen the surgery part because I got scared. I was like, no.
Yeah, no,
look
it's
at those.
it is. It's intense.
Yeah.
Intense.
It's yeah.
I didn't take any of the
Pain meds?
No, you guys did great. I didn't feel any pain after. Nothing.
Like, don't get me in my giddy up.
All right, I'm gonna get out of here.
Okay, we'll go.
Well, thank you.